millions worldwide. It doesn't discriminate. It can affect anyone, regardless of age, race, or background. It's different from occasional sadness. It's a persistent feeling of hopelessness that doesn't easily go away. Imagine carrying a heavy weight daily, feeling tired and losing interest in things you once enjoyed. This burden can make even the simplest tasks feel insurmountable. These feelings can make everyday tasks, like going to work or school, challenging. Getting out of bed can feel like a monumental effort. Depression affects people of all ages, races, and backgrounds. It doesn't matter where you come from or what your life looks like on the outside. It's more common in women than men, but it can affect anyone. Hormonal changes, societal pressures, and other factors can contribute to this disparity. Often misunderstood and stigmatized, depression can be hard to talk about. Many people feel ashamed or embarrassed to admit they're struggling. Remember, depression is a real illness with real symptoms. It's not something you can just snap out of or ignore. It's not a sign of weakness. Seeking help is a sign of strength and courage. With the right treatment and support, recovery is possible. There is hope and there is help available. You don't have to go through this alone. Clinical depression or major depressive disorder is more than just feeling sad. It's a persistent condition affecting thoughts, emotions, and behaviors. Unlike temporary sadness, clinical depression lingers for weeks or more. It makes experiencing joy or motivation difficult. Symptoms include changes in appetite, sleep disturbances, fatigue, and recurrent thoughts of death. Depression can arise from genetics, brain chemistry, life experiences, and stressors. It requires professional attention and treatment. Depression is a complex illness with no single cause. It manifests differently in each individual, making it a deeply personal experience. Key factors include genetic predisposition, brain chemistry imbalances, and environmental stressors. These elements interact in unique ways to influence the onset and progression of depression. Genetic factors can increase susceptibility to depression. Specific genes have been identified that may contribute to this heightened risk. Studies show a family history of depression raises the risk. This familial link suggests that both genetic and environmental factors within families play a role. Brain chemistry plays a crucial role, with neurotransmitter imbalances linked to depression. Serotonin, dopamine, and norepinephrine are often implicated. Environmental stressors like traumatic events or chronic stress can trigger symptoms. These stressors can overwhelm an individual's coping mechanisms. Life events such as loss, financial difficulties, or relationship problems can exacerbate depression. These challenges can create a sense of hopelessness and despair. Social isolation and neglect also increase the risk. A lack of social support can leave individuals feeling alone and vulnerable. Seeking help for depression is crucial for recovery. It is the first step towards healing and regaining control over one's life. Reaching out to professionals can provide the necessary support and guidance. Stigma and fear of judgment can prevent individuals from seeking support. Many people worry about what others might think or say, which can be a significant barrier to getting the help they need. Lack of awareness and understanding of depression also delays help. Education and open conversations about mental health can bridge this gap, making it easier for people to recognize when they need assistance. Many mistake symptoms for normal sadness or stress. It's important to differentiate between temporary feelings and persistent symptoms that may indicate a deeper issue. Raising awareness and promoting mental health literacy can reduce stigma. Community efforts and campaigns play a vital role in changing perceptions and encouraging people to seek help without fear. Educate about the signs and importance of seeking professional help. Understanding the symptoms and knowing when to reach out can make a significant difference in someone's journey to recovery. Support involves empathy, understanding, and practical assistance. Being there for someone, listening without judgment, and offering help can provide immense comfort and encouragement. Encourage professional help and be patient as recovery takes time. It's a gradual process, and having a supportive network can make all the difference in someone's path to wellness.